تيست تيست. صوت. ايوه تيست تيست. تيست 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 تيست. ايوه تيست تيست تيست. ايوه تيست تيست. ايوه تيست تيست.
بسم الله الرحمن الرحيم. Okay.
قفلته. بسم الله الرحمن الرحيم. نتشرف بدعوتكم لحضور الجلسة الأولى الجزء الثاني ده الاكستنشن بعد الغداء. بنتمنى تكونوا أخدتوا بريك كويس، انبسطتوا، ريحتوا، شفتوا المستشفى، وبالتالي بنستعد للجزء الثاني علشان نقدر نستكمل النشاط العلمي بتاع المؤتمر. Now we are going to start the second session, second part of the first session, and we are inviting Dr. Osama Musallam to present his paper. The title is an attracting title, okay? The title is the 6 specialties in nursing in the 6 yes, okay? So it is true, yes, it's true. It is the 6th specialty in nursing in the 21st century. Now we are, yes, it's part of my specialty is to work with psychosexology. Now we are going to listen to Dr. Osama Musallam.
Thank you very much. It is my pleasure and my honor to be with you today in the 3rd nursing conference in 57357 in collaboration with Cairo University and in presence of and collaboration with universities from the States and friends and colleagues from the States. I don't like to disappoint you. I'm not going to talk about sex. I'm going to talk about data because according to many statistics and research that the data analyst will be the sexiest post or job on the 2014. Actually, when we talked about subspecialties in nursing, this morning we talked about 6 main specialties, including something like 40 subspecialties. I would like to add a new one, which is data analysis. Data analysis is going to be a very important function in the next few decades. According to Harvard Business Review, which is a very important journal in management, Shakespeare has a very famous play called Tarweed al-Namira. Actually, this is exactly what we are going to talk about today in dealing with big data, which is how to shrew the data. Dr. Mahmoud Fathallah is my mentor. He was the Dean of School of Medicine in Asyut University, and he is a very well-known international figure. He was the head of the FIGO, the International Federation of Obstetrician and Gynecologists. He has a very famous, I would like to quote him, that statistics don't bleed, but patients do bleed. So it's very important in dealing with data to give the data some feelings, some emotions. Statistics are emotionless, but the patients suffer. So in big data, we are trying to have some facts, some clue for decision making that's not clear for the human mind. If I'm going to say a few words in Arabic, كلنا عارفين الأستاذ الدكتور حسام موافي هو أبو الأمراض الباطنة في مصر وأستاذ لأجيال كتيرة. له كلمة ممكن تبقى قاسية شوية متشائمة شوية لكن أحيانا بتبقى صحيحة. بيقول أنت كده كده هيموت منك عيانين، بس لو أنت مذاكر يعني فاهم اللي بتعمله ومات منك عيان فده قتل خطأ. أما لو أنت مش مذاكر ومات منك عيان فده قتل عمد. كأن دورنا أساسا إن إحنا هنموت العيانين، بس التكييف بتاعها القانوني هيبقى قتل عمد ولا قتل خطأ. طبعا هو بيضحك لكن قصده إن إحنا we have to have very strong deep sense of responsibility during doing our work. إحنا definitely مش عايزين أي عيان يموت منا. لو هنشوف في الآيات القرآنية آيات كتير بتتكلم على الإحصاء وكل شيء أحصيناه كتابا. actually لما بنتكلم على الداتا analysis in healthcare لما عملوا تقدير للamount of data used in clinical trials in USA it wouldn't exceed 2% من الايسبرغ و 98% not used. لما بنتكلم على البيج داتا big adjective لكن now it is a term. When talking about big data we are talking about the 98% of data that not analyzed in any healthcare system. In contrast with clinical trials, in clinical trials we put a hypothesis, assumption, idea, then we are going to collect data to verify such hypothesis. In big data we have the data and we are going to use very sophisticated techniques to reach some hypothesis or maybe facts by using data. So it is not conflicting at all with clinical trials. It is almost the opposite of clinical trials. In clinical trials we put hypothesis, then we collect data related to this hypothesis. In big data we have huge amount of data and we are trying to reach some facts from such data. In some statistics that only 10% of the available data in the world done 3 years ago from the start of life, and 90% in the last 2 years. So there is incremental increase in the amount and volume of data that we have every day, every hour, every minute. This is why some people put it as BBD and ABD, before big data and after big data. This is how to classify history. Lord Kelvin said a very famous quote, and I'm sure Dr. Sharif likes it and he likes to use it many times. You cannot manage what you cannot measure. But actually we have a completely different situation now. We cannot manage